Welcome to our detailed guide on the cleaning procedure for endoscopes. With this video, we'll take you through the steps of cleaning and disinfecting a gastroscope. Use this technique following each procedure. To get started, you'll need a diluted soap solution made with any mild dishwashing soap. Instrument enzymatic cleaner solution suitable for flexible endoscopes, and also an approved disinfectant for flexible endoscopes. You'll need tap water, distilled water, a biopsy channel cleaning brush, a 60 cc syringe attached to a channel flushing tube fitted with a three-way valve, an air, water, and suction plug, and finally, a water bottle connector plug. We'll do a light soapy cleaning, then we'll soak the scope in an enzyme cleaner, followed by a disinfection. The biopsy channel starts at the insertion point and extends to the distal tip of the endoscope. The suction channel begins at the distal tip of the endoscope. It is activated by the suction button. It then terminates at the Christmas tree valve on the plug on the scope. The next step in the process is to make sure there are no leaks. Attach the leak tester, which is a pressurized manometer, to the system, then pressurize it to 160 millimeters of mercury and make sure it does not decrease 10 millimeters of mercury over 30 seconds. If the pressure does not drop more than 10 millimeters of mercury, the instrument is watertight and may be immersed for cleaning. Always depressurize the system before disconnecting and removing the leak tester. The first step of the process is to flush out the air-water channel to remove any debris in the channel and from the end of the scope. With the scope still attached to the processor air compressor, press the air-water button for 1 minute. Next, suction about 100 cc's of remaining water through the suction channel from the water bottle. Using a clean damp cloth or gauze sponge, remove any surface residue from the scope. The next step is to clean the external surface of the scope using a mild detergent solution. Once the outside of the scope is cleaned, pass a biopsy cleaning brush through the biopsy channel so it comes out the end of the biopsy opening at the tip of the scope, and withdraw it in the same fashion. Remove the blue air water button and the red suction button. They should be clean and disinfected as well. Pass a biopsy cleaning brush through the suction channel so it comes out the end of the suction opening at the Christmas tree valve, and withdraw it in the same fashion. Bend the biopsy cleaning brush to a right angle. Pass the brush through the red biopsy channel. Feed the brush through the biopsy channel until it appears at the distal tip of the scope. Attach the video connector watertight cap. Cover the water bottle connection. Attach the air, water, and suction plug in place of the buttons. Attach the channel flushing tube to the suction connector of the umbilical attachment. Using a 60 cc syringe and the channel flushing tube, flush soapy water through the suction channel at least 3 times. Rinse the outside of the scope with clean tap water and flush clean tap water through the suction channel at least 3 times. Prepare the enzyme cleaner from concentrate according to directions. Submerge the scope in the enzyme solution and flush solution through the suction channel at least 3 times. Soak the scope for the recommended time, which is usually about 20 minutes. Once the appropriate time has elapsed, remove the scope from the solution and rinse it completely with tap water as before. Prepare the disinfectant according to directions. Immerse the scope into the solution and flush disinfectant through the suction channel as before, and soak for the recommended amount of time. Once the time is up, remove the scope from the disinfectant and rinse with tap water, including the suction channel. Then give the scope the final rinse. Rinse with distilled water, making sure to flush the suction channel and air water channel at least 3 times. Dry the outside of the endoscope using a soft cloth. With the blue and red buttons removed, hang the scope so that any residual water in the suction and air water channels drain out and evaporate. Do not store the scope in its carrying case.
The endoscope should be leak tested prior to the next procedure.
And there you have it, a quick and easy method for endoscope cleaning and disinfecting.